Analysis and Reflection by Emma Van Auker. The interpersonal characteristics that the client presented was confusion, frustration, and nervousness. She was confused on what the difference was between occupational therapy and physical therapy. And she was frustrated about medical school, and she was nervous about the home adjustment. Interpersonal events that happened during the interaction were resistance, expression of strong emotion, and emotionally charged therapeutic tasks. Lily wants to go back to medical school, but she needs to focus on other things first before she can, and at first she was resistant. Lily also expressed a strong emotion when she said, "It'll be nice to be out of the hospital for once." This emphasized that she had strong feelings of disappointment and frustration. And an emotionally charged therapeutic task was when we talked about how we're going to change her house. Active listening and responding. The International Journal of Listening states that improving active listening skills helps increase cultural competence. The journal presents a research study that shows that active listening leads to a deeper understanding of the patient's culture. It is important to understand where someone is coming from so we can provide patients with the best care possible. I included multiple examples of active listening in my video, by first including strategic questioning when I asked about her goals, and we talked about how she could achieve certain goals. I also used enrichment questioning to figure out why she wanted to go into medical school and how she could gain that purpose back. I also repeated back to her when she said her mom was in her life and made sure to include her mom in the therapeutic process. And at the end, I asked a clarifying question when I wanted to make sure we could schedule our next appointment. Clarifying content and feelings. She mentioned that she was nervous, and I said it made sense that she felt nervous about the situation. And another example was when she was talking about how much she wanted to go back to medical school. So then I used assertiveness to change the topic and focus on things she could do right now. Nonverbal communication. The IEEE studies communication patterns of healthcare workers, and it shows that having good bedside manner is crucial to good patient care. The researchers state that the ability to understand and convey nonverbal signals is essential to forming empathetic relationships and patient-centered care. Two examples that I used in my video was maintaining eye contact and open body language and using hand gestures. One mode I used was the empathetic mode. Frontiers in Psychiatry wrote a meta-analysis about how perceived empathy affects patients. The result of this study is that empathy is crucial in determining the quality of care and patient satisfaction during healthcare services provided by healthcare workers. In my video, I used the empathy mode when working with Lily. When Lily was nervous, I validated her feelings to show empathy. Another therapeutic mode that I used was the collaboration mode. The Science Direct says that collaboration among healthcare teams may improve patient education and patient engagement in their care, including behavioral changes such as information seeking and effective delivery of information, patient involvement in decision-making, and patient participation and self-care. It is important to involve the patients with their care, and I included this in my video with Lily when we were talking about improving her house for her safety and needs. Another mode that I used was the encouraging mode. According to the Scandinavian Journal of Occupational Therapy, the encouraging mode requires the occupational therapist to behave in a manner that commends and applauds the client's performance. The encouraging mode can lead a patient to feeling more confident with themselves, which is essential for recovery. I included this in my video with Lily when she explained why she wanted to go to medical school. I explained to her that she could still help people without going into medicine. Culture and diversity. The Science Direct posted a qualitative study surrounding 13 people that have upper limb amputations, and it states that adapting to social challenges comprised hiding or exposing the hand, using personal internal resources, and receiving support from others. It can be more difficult to go out in public because of the prosthetics, so it can feel lonely. The study talks about how many people feel isolated and lost friends after receiving prosthetics, which can affect mental health. The Journal of Urban Health says that women tend to mobilize more support than men during the periods of stress. Lily went through a traumatic event, so she may not be getting the social support that she needs. Westernized culture struggles with talking about mental health and socializing with people that are different. The Frontier in Psychiatry says the Enlightenment has provided contemporary Western culture with the ideals of individual rights, which has led it to be hard to talk about mental health. After Lily got prosthetics, she was not able to go running or to medical school, and her independence was taken away. She has a smaller support group than before, which can affect mental health, and Westernized culture has made it hard to talk about mental health. Self reflection and limitations. I think I could have fidgeted less because that could distract the patient and not feel good. I also think I could have had better posture. I think it was difficult to not work with Lily personally, and I would have responded differently if it had been her. I also could have described occupational therapy better by saying we help people perform daily tasks that they want to do related to their goals and activities of daily living. Evaluation. I think I did pretty well. I could have emphasized the therapeutic modes more, but I was trying to do it without reading off of a script. I tried to apply the deeper knowledge I had from class to simulate a real life scenario. I had my patient come up with some things on the spot, so then I would have to figure out how to respond without preparation because that will happen in real life. Summary. References. Thank you for listening.